everyone, I'm Dr. Jessica Babbage, a physical therapist specializing in pelvic health, and today we're tackling a big question. What does a pelvic floor physical therapist actually do? Spoiler alert, it's a lot more than just helping women with Kegels. Before we get into it, let's clear up a major misconception. Pelvic floor physical therapy isn't just for women. We all have pelvic floor muscles, so this type of therapy can be for anyone, regardless of gender or age. Whether you're a new mom, a post-proctectomy patient, an athlete, or even a child struggling with bladder control issues, pelvic health is for everyone. But what exactly is the pelvic floor? The pelvic floor is a group of muscles that sit in the bicycle seat area of your pelvis. They support key organs like the bladder, uterus if you have one, and rectum. These muscles play a huge role in bladder and bowel control, sexual function, and core stability. When these muscles are too tight, too weak, or not coordinating properly, they can lead to an array of issues like pelvic pain, bladder and bowel leakage, chronic constipation, painful sex, and pelvic organ prolapse, just to name a few. These symptoms can significantly impact your quality of life, making it harder to stay active, feel comfortable, and enjoy your everyday activities. So what does a pelvic floor therapist actually do? First, we start with a comprehensive evaluation. We begin by gathering information about your symptoms, medical history, and daily activities. But it doesn't stop there. We also look at your whole body. We'll evaluate your posture, movement strategies, breathing patterns, muscle function and coordination. We're gonna look at how everything is working together. And after that, we're gonna assess your pelvic floor directly to see how it's functioning on its own and in connection with the rest of your body. You might be wondering, why not just focus on the pelvic floor? Well, imagine your body is like a house with a leaky roof. Fixing just one spot won't solve the problem if the underlying structure is weak. It's the same with the body. If the muscles are out of balance or your core isn't providing enough support, treating the pelvic floor alone won't bring lasting results. That's why a holistic approach is so important. The goal is to address the root cause of your symptoms, so not just patch up surface level issues. People often ask, what does a pelvic floor exam actually look like? Well, it's a bit different from a visit to your gynecologist, urologist, or gastro. Pelvic floor exams can be done externally, focusing on the muscles, ligaments, and tissues around the pelvis, lower back, and hips. But we may also perform an internal examination. This is always done with your consent. We do this to get a clear picture of how your pelvic floor muscles are functioning. As experts in the musculoskeletal and neuromuscular function, we're not just looking for pain and tenderness. We're assessing how these muscles are working, their strength, their coordination and flexibility, and their overall ability to support your body. This detailed evaluation helps us create a personalized plan that targets your specific concerns and unique needs. So what does a treatment plan look like? After the evaluation, we'll create a treatment plan tailored to your unique needs. This isn't a one-size-fits-all approach. Your plan might include a combination of targeted exercises to strengthen or relax your pelvic floor, hands-on manual therapy to release tight areas or scar tissue, and strategies to improve how your core and pelvic floor muscles work together. We also look at ways to optimize posture, breathing, and daily movements to reduce strain on your body. But there's more. Because the pelvic floor is influenced by the nervous system, we may use pain education and nervous system retraining techniques to help your brain and muscles communicate better. Sometimes the brain can become hypersensitive and misinterpret normal sensations as pain. So it's crucial to address the mind-body connection to retrain how your brain perceives pain and function. We'll also integrate lifestyle and behavioral modification, like improving toileting habits, managing stress, and finding positions that work for your body during everyday activities. So when is pelvic floor therapy the right choice? Here are some signs to look out for. Bladder leakage with laughing, coughing, or exercise, bowel issues like constipation or difficulty controlling bowel movements, pain during sex or while using tampons or during a gynecological exam, pelvic pain or pressure, fertility, pregnancy, and postpartum recovery even years after birth, if you have lower back or hip pain that just won't go away, and after any sort of prostate, gynecological, or abdominal surgeries. If any of these sound familiar, it might be time to see a pelvic floor physical therapist. Bottom line, pelvic floor therapy is for everyone dealing with these kind of issues. It's not just about one set of muscles. It's about understanding how the pelvic floor fits into your whole body. When done right, pelvic floor therapy can be life-changing. If you found this helpful, hit the like button and subscribe below. Drop a comment if you have any questions. Your health is your power. Take charge of it. Thanks for watching, and we'll see you in the next video.